Good day, everyone. Welcome to this online lecture on program evaluation. In this lecture, we will focus our attention on the areas of developing or formulating evaluation questions. So let us now proceed with formulating evaluation questions. Um, and before we continue, let's review what we have discussed so far. Last time we talked about the purpose of evaluation. And the purpose of evaluation should be differentiated from the objective of evaluation. The purpose of evaluation is basically why you are doing evaluation. And the objectives will have to support the achievement of that particular purpose. And the purpose of your evaluation is basically based on the program status, the program goals, objectives, and when I say status, where are you now at the particular point of the program implementation? Are you at the end, terminal? Are you just starting? Are you in the middle? Or are you even just beginning to plan for a program? In that case, you may need a different evaluation approach because you will be using evaluation to identify the goals, objectives, and inputs needed for the implementation of the program. So all those information that you have about the program, as I said, would influence your purpose. And therefore, depending on the purpose, you will be able to identify what approach or approaches you may be using. When I say approaches, you can actually combine approaches together. So for example, if your purpose is to determine if the product is worth continuing in terms of, like, say, you're providing an alternative mode of teaching and you want to continue using that mode, then you may want to ask the stakeholders, your students, your parents, are they amenable to those particular to the type of intervention that you're using, or are your materials or the materials that you're producing, for example, useful to the user? I remember a few years back when Department of Education was accused of endorsing books that are that were not properly edited, or providing wrong what I call it, data about some of the things that book is supposed to be helping to teach students to learn. So in that case, you may want to use a consumer oriented, right? And as discussed by, for example, by Arden, talk about you want your program to be accredited, then you may want an expertise oriented type of approach. But that's basically because you want to be accredited. So it depends on the purpose. If you don't want to be accredited, then you don't need to go to accreditation approach, right? Um, if you are into implementation of the program, then you probably would like to know, am I able to implement the program the way I'm supposed to implement it, as by design? Or if you are to make decisions and down the line. So as I said, your approach will again help you be able to identify what specific questions you will or you need to formulate to as you move forward with the design. So let's say, for example, here, if you have uh, consumer oriented, then you may want to talk about reaction to the product. Program oriented, and then are you achieving the program as intended? So it's about intent versus observed. You said you'd have this number of activities. Are you producing those number of activities? You said you will be reaching this number of people, of students. Are you reaching the number of students you target to achieve or to reach? And in terms of decision oriented, the decision will be, do you want to continue? If we are to continue, do we need to change some of our goals? Are our goals still relevant at this particular point? If we are to continue, do we need to change our methodology, our do we still need? Can we still use small group learning, remote learning? Can we still use small problem-based learning, or do we go back to traditional learning? And participant-oriented is on the central, will basically be related to the central question: how what are the participants to the evaluation, and what will be their role in the overall evaluation process? So, so you can actually do all the approaches above: the expertise oriented, you have the approach or program oriented, and the decision oriented. And you may want to make sure that in all of those approaches, you are also practicing participatory research or participatory evaluation. So you identify more people who will be part of the evaluation process. And of course, as we now continue with our discussion, we go to more specific ways of generating the questions. And there are two major phases: the divergent phase, which is basically expanding, going out, and the convergence, where you put them all together. And let's focus on that. So why do we need to really spend a lot of time in formulating good evaluation questions? Why do we need to do that? Why is it important? It's important because if we overlook some questions, then we might experience the following: little or no payoff from the expenditure for the evaluation. Meaning, after you spend a lot of money and after collecting data and spending a lot of time going around collecting data, and then at the end of the day I will ask you, so what now? And then you realize there's actually a question that is very crucial that you did not ask. So the school owner wants a major decision on continuation of the product, but you did not actually ask about the reaction of users related to the product. So if you don't also develop a quality question, or you overlook important questions, you may have a myopic view of the program, and that may direct your future efforts. You thought you're doing it great, when in fact actually you are not, because you probably asked questions that will be telling you that you're great, and you avoided questions that may be painful to know. Since you did not ask the correct questions that stakeholders would like to know, then they would just tell you, I don't really buy the results of your program. I think you're so biased to the point that, say, you're just biased to the owner, or you're just biased to some group of stakeholders, or you're biased towards the government agency that is implementing or supporting the program, and you lose credibility. And even when you have a good result, then other people will say, well, seems to be good results, but in reality that's not what we're seeing, or that's not what we're observing. And of course, bad evaluation may disenfranchise legitimate, here you use stockholders, because you're looking at schools, for example, in a private perspective. But because of, for example, let's say at the level of participatory approach, let's say, for example, because of the limited participation of major stockholders or stakeholders, for that matter, then they will feel like they're not part of the whole process. And that will be bad for the future implementation of the program. And of course, the most important is, as in like in research, you may be producing an unjustified conclusion, meaning you say, this is our conclusion regarding the program is successful, very good, or you talk about no people, it's not very good, it's not functioning the way it's supposed to be. That may be your conclusion, but at the end of the day, did you ask the correct questions? As they say in research and in instrument development, it's not actually the most difficult part. Actually, is not getting the correct answers. It's actually asking the correct questions. So when you decide to develop further your questions, you need to consider the following. What is the main need that the intervention is attempting to address? Like say in an educational setting, what is this program addressing? Like say for example, some the presentation of some of you related to internship program. So what is it that you want? What do you want to address? Is it the issue of um, are our partner facilities appropriate for the type of competencies that we want to produce? Are the institutions liked by or providing the appropriate environment for training for your interns or for your students? And if you're talking, for example, of let's say a residency training program, postgraduate program in let's say general medicine, um, are you really addressing the issue of developing primary care internal med residents? Or are you just calling it that way, but in reality, all the elements of the training programs are almost similar to the regular residency training program? There's no change, right? It doesn't matter actually what you're doing. It's also important for you to consider before you run an evaluation to ask your stakeholders, your partners, what exactly do they want? What are their interests? You don't just ask your stakeholders after the evaluation is done. So when you are, for example, asked by the principal or your dean to perform or to design an evaluation, you don't just talk to the dean. You may also would like to talk to the teachers, to the students. Are there things of interest for them that they may want you to include in the evaluation? And it's important because the more people with stake in the program actively participants to the evaluation process, then the more that your evaluation program will be acceptable to the audience that will eventually listen to your report and will utilize your report. Say teachers who will utilize your recommendations, administration who will have to respond to the recommendations about changes in financing or in schedule or recruiting more people. So if they are part of the whole development process, it might be much more easier for you to communicate the recommendations, the results, and the recommendations of your evaluation. So therefore, just to at this point to summarize, what are the key things that you should also consider among from what we discussed earlier? You need to also consider the following: the importance of that question. One, it's a nice question, but is it worth asking the question? If you ask this question, will you be able to have access to data? How difficult is the data? For example, let's say some of our students here in HPED are trying to propose a research related to PRC results, performance of certain groups, schools, and sort of thing in a specific licensure examination. But at the end of the day, you realize PRC will not be releasing all this information. you will not be able to access the data, and you will be just told, maybe it's not worth doing this evaluation because there's so many limitations to the release of information that it's so impossible for you to get them. And of course, corollary to this is availability. So let's go back to them again. What is the relative importance of the possible question to the overall objective or purpose of the evaluation? What will these questions require in terms of data and ease of access? Do you have electronic data? For example, I've been through so many evaluations. When we go back to training, we realize that the training group were not even collecting data about trainees. Who are the participants? Where they are coming from? What are their gender distribution? What are the prerequisite uh, or what are the profession that they are carrying with them as they go through the program? What department are they? Do they belong to? What are their, for example, preparation for the workshop? And you realize after several years, after a year, that you go back to the training and try to evaluate, there are no information. You cannot even talk about is there a relationship between gender and performance, because they did not even collect information about gender. So now it's not available because it was not predetermined, or they were not conscious enough to consider this information as they move forward. And the availability for answering possible questions. Do we still have the people who started the program? Are still there around? Have they moved on? Can we still access them? Let's say, for example, you're developing or trying to ask the historical development of the program, and you want to know why it was started in the first place. What factors were considered by the proponents of the program 10 years ago, 15 years ago, because we want to know how it progressed from the very beginning. And can you access them? Are they still available? So it's important. Now we can say, probably you can at least schedule a Zoom meeting with them. At least now you have more opportunities. But before, where do you get them? How do you get them? So in terms of now formulating all these questions, you will have to go to two major phases of question development. And the first phase is basically the divergent phase. And the second is the convergent phase. So when you talk about divergent phase, we talk about mapping out the terrain, laundry list of potential questions, criteria and issues. You don't limit yourself. Say, if you are using, for example, like brainstorming technique, you know that the one major characteristic of brainstorming is you don't disregard any, or you don't let's say throw away any recommendation for questions. So if you're looking into divergent mapping the terrain, you have to accept as many questions as possible, because you're trying to collect as many questions that you may be able to use in the program. And then you go into convergent, where you put them all together after generating the laundry list of questions. Then you develop probably your own criteria for selecting the questions that you will finally use. It's more like priority setting. And now we will now go to categorizing these questions according to whether they are descriptive questions, for example. Questions are questions that answer the question, what is? So technically it talks about how many faculty members, for example, participated in the OB curriculum development. So what is? You just describe how many have you reached, how many teachers were trained, right? The level of knowledge, skills, attitude, pre-post, these are describing the amount of money you raised in a fundraising, the degree of satisfaction, and if you're a consumer oriented, talk about how many users will reach by your material. So you can identify more. No? So as you develop your questions, you can already deduce if your question is a descriptive, right? So let's say how much money was spent, um, how wide in terms of the national distribution of participants were you able to reach on the national level, regional level, or the local level. So these are descriptive type of questions. You're familiar with that. You also have the normative questions, and that is basically comparing your data, comparing your to compare your results or your outcome with standards. Say earlier we talked about using standards of professions. If the occupational therapy association, for example, will have their own standard for internship, so you can talk about how well is this program providing in relation providing the requirement of the standard for a particular facility, or if you're looking into bed requirement for residency training, are we actually providing the 10% requirement for charity beds in our training program? So it's a matter of just comparing your program with the standard. If you're looking at the board examination, talk about um, being able to achieve, if the national standard is 65% passing in the board rating, are you getting the standards? How many percent of your students are actually passing the licensure examination? These are the standards. So example here, did we meet our objective of training 100% of full-time faculty members? So your target for 1 year is that all of your faculty members in pediatrics or all your consultants, all your intern coordinators would have received a training on soft skills in intra-professional collaboration. That's your target. Were you able to reach the target? Because your standard is 100%, were you able to get the 100%? If your standard, for example, is recruiting students that would represent the various regions of the country, are you fulfilling that? How many percent of your students are actually coming from Mindanao? Like in UP, for example, we have regional distribution or regional allotment. Or are we getting more and more of our students from Metro Manila? And in that case, we are not fulfilling our of providing this kind of distribution. How many percent of your graduates are serving the rural community? Or how many of your student graduates actually did the return service agreement? Or how many of your graduates just decided to pay the return service agreement requirement because they want to leave the country? And all questions related to the outcome or the intervention, the result of the intervention. Is there a difference between their score before to their score after? You're not talking of standards, you're just talking about difference in terms of a particular intervention. Let's say you have two interventions. You have using a particular problem-based, or you're using a traditional lecture, and schools would use it to compare their performance in the board, and many schools decided to go back to traditional curriculum because they thought that their scores did not improve when they started using innovation. So some of the counter questions you can ask: did training resulted in increasing quality of faculty? For example, if you did the faculty development and test construction. Let's say, for example, you did training for mothers and you want them to increase their income because of the current economic crisis, so you provide them with training in, like, say, producing handmade materials or homemade food, delicacies that they can sell. Uh, did they increase the income after that, or they remain poor? Then you realize maybe it's just that's not the right training for them. Or did it result to other impact? It's more of not all results are positive. Sometimes you thought that will be the result, and you end up with a more negative. You thought that training would provide people with more positive attitude towards gender equality or teenage pregnancy, and after the training, they came out in the training more negative with their perception. Their attitude, instead of changing, became more what you call it, alienated. Became more alienated with the proposal that you want them to accept. So just the remaining two slides. You talk about outcome impact. So you talk about following a certain theoretical framework like logical theory. And time order theory. So when you talk about logical theory, you should be able to see that indeed the outcome is brought about by the intervention. So it makes sense, meaning you give them lecture, it's a natural, I think, outcome that they will learn the content, right? There should be a logical relationship. Not like, say, you use a certain intervention, but even literature will tell you it will not have impact on knowledge. And then from the very beginning, that particular program intervention, it will not yield a good result in evaluation. And it's also important to check if the outcome came after the intervention, not the outcome first and then the intervention. It's more like saying that when the student came into your class, they already have 100% scoring pre-test. So when you did your intervention, you had also 100% score in post-test. Well, they already have 100% score in pre-test. So your intervention did not contribute to the achievement of the outcome. So make sure that the outcome is measured after an intervention. No, so there have to be the time element, the order in terms of when you will measure an outcome, especially if you're looking to an outcome-oriented type of evaluation or the program-oriented eval. And you can also look into the covariation. If you, for example, you're looking at two interventions, say you want to produce a heavy, good muscle development, you want to make sure that the intervention that you used will both have effect on the muscle development. You cannot use, say the question is my exercise effective? But you compared it with book reading, right? It cannot be, right? Reading a book will not produce strong muscles, probably more knowledge, but they are not comparable. So make sure that when you do those things, it's important that they can both produce the outcome that you want, and that the evaluation should be able to eliminate the covariation or the covariant, meaning based on your statistical data, you will be able to safely say and with confidence that indeed this particular intervention is the one causing the effect. So in education, for example, you want to know if indeed your intervention, what you did, caused that increased results in the boards. What if the increased results in the board is brought about by suddenly a shift in the board examination, what do you call it, in policies, and the questions became much more easier, or that it's not about your education, it's not about your intervention, but rather about students requiring your students to take the review classes, and the passing in the board is not anymore about what they learned in med school, but rather what they were able to review in the review school, and the review school were able to provide them with specific knowledge that by luck are the same knowledge required to answer the board exam questions. So okay, so it's important that you go through this and practice the question development process, because as I said, your answer is only as good as your question. So as I said earlier, there are no wrong answers, only wrong questions, because there will always be the right answer. But did you ask the correct question? Because if you did not, and if you will not, then your evaluation, as I said in the first page, why it's important for us to develop appropriate questions, because that will make or break your eval.